everyone, you're watching Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. The Biden administration's test to treat initiative not safe. COVID-19 vaccines are continuously put to test for their efficacy and safety against the newly coming variants of the novel coronavirus. Joe Biden, the US President, in his State of the Union addresses last week introduced a new test to treat initiative that will allow people who test positive for COVID-19 at a pharmacy to receive antiviral pills on the spot at no cost. In response to the initiative taken by the President, the American Medical Association expressed concerns that it would bypass the expertise of primary care physicians, who the organization argues are the most suited to prescribe treatments. Leaving prescribing decisions in the hands of people without knowledge of a patient's medical history is definitely dangerous in practice, and the precedent isn't advisable, according to the American Medical Association. The association further urges that patients who test positive for COVID-19 to contact their physician to discuss treatment options rather than random antiviral prescriptions. Early monomorphic ventricular tachycardia tied to long-term mortality in STEMI. Early ventricular tachycardia and ventricular fibrillation are shown to be associated with increased in-hospital mortality, but does not impact the long-term prognosis in ST elevation myocardial infarction cases. Now, a recent data of study appearing in the American Journal of Cardiology supports a differential approach to this arrhythmia type, and it indicated that long-term mortality hazard tied to monomorphic ventricular tachycardia. Early monomorphic ventricular tachycardia, that is VFib, compared to non-monomorphic VT or VFib, that is ventricular fibrillation, is associated with a higher risk of all-cause mortality in STEMI patients. Cardiovascular risk for patients with and without serious mental disorders. A study in the Journal of the American Heart Association compared the estimated 10-year and 30-year cardiovascular risk in primary care patients with and without serious mental illnesses like bipolar disorder, schizophrenia, or schizoaffective disorder. Now, the study found that the significantly increased cardiovascular risk was associated with serious mental disorders is quite evident even in young adults. This suggests the importance of addressing uncontrolled major cardiovascular risk factors in those with serious mental disorders at as early an age as possible. Elevated lipoprotein A and coronary artery calcium score combination independently linked with atherosclerotic cardiovascular disease risk. A recent study in the Journal of the American College of Cardiology sought to investigate the independent and joint association of elevated lipoproteins and coronary artery calcium with atherosclerotic cardiovascular disease risk, and the researchers further found that the lipoprotein A and coronary artery calcium scores are two independent factors. That is, they are independently associated with atherosclerotic cardiovascular disease risk and may be useful concurrently for guiding primary prevention therapy decisions. Assisted reproduction to increase risk for vascular and pregnancy complications. Assisted reproductive technology, ART. Now, the goal of this should be the provision of safe, efficient, and affordable care to optimize the chances of having singleton pregnancies and the delivery of healthy babies. The findings in the Journal of the American Heart Association highlight that the importance of counseling of women who are considering assisted reproductive technology, that is the ART, about health and pregnancy, as well as the postpartum related risks. Now, the study reports about the potentially long-term cardiovascular implications and even the risks that have been associated with this particular technology, wherein the researchers have emphasized on the fact that women who conceived with ART, that is the assisted reproductive technology, were much older than women who conceived naturally with a mean age between 35 to 28 years and had more pre-existing health conditions such as hypertension, obesity, and even diabetes that led to both vascular and pregnancy complications. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.